All right, everybody. This is John. Just giving you your Black One wrap up. First off, congratulations on everyone getting Block 1 completed. Overall, everyone did really well, especially for a lot of you guys. It was your first management course, and overall, everyone did quite well. So I want to give you just a real quick little rundown of my red flag story. So I saw this lady probably a year and a half ago, but still in good contact with her. But she's a 49-year-old female who was a previous patient, but I haven't seen her in probably 4 years. Chief complaint was neck pain, more so than thoracic pain, where she was having spasms. NPRS is as follows. She began having symptoms a couple years ago, which definitely got worse over the last 6 months. Does not recall a specific mechanism MOI, but did have lap band surgery and lost 174 pounds, which she thinks changed her posture. You can see quality, and you can see all the other descriptions as on there. Objectively, nothing really stuck out. She was pretty stiff into the neck, but she did have a history of effusion. So long story short, after about 4 visits, we got her about 80% better, shifted to her thoracic spine with no changes after the 3 visits. She was referred back to her primary care for imaging due to the consistent low-grade symptoms. We were not able to get any inter or intra-session changes, which was kind of the big one that stuck out to me. And the moral of the story, cancer sucks. So she was diagnosed with stage 4 small cell lung cancer, which is terminal. She currently is at 9th grader. So the 1-year survival rate is less than 25%. She is actually over a 1-year survival rate at this point, and seems to be doing relatively well considering. So big thing too with this is she was able to get kind of her affairs in order, get everything established. So if worst case scenario something happens, everything will be taken care of. So not the best, but it still gives us an idea of how we can be super effective in that process. So shout outs. I think everyone did a great job. Block 1 can be difficult, especially trying to figure out all the rules, and can definitely be overwhelming initially. I would say our shout outs for this block are Gil and Samantha. You guys both did an amazing job, and keep up the good work. Quick review. Initial posts are due Sunday by midnight. The first week, that first response is due Tuesday, and the second by Thursday. Promote good discussion, not just compliments or 1 or 2 lines. Respond to your original post that following week, and then complete your quiz also. Your original post and each response should have an article referenced, as well as cited, and if you can provide the full text, that would be greatly appreciated, so that myself, Zach, can make sure that you're not getting it off of an abstract, as well as your colleagues now are able to kind of read and go through your article as well. Use your own words, don't just copy the article or the conclusion, and then make sure when you're citing that it goes author, last name, and then first name, title of the article, journal, date, volume, pages. So review of the material. Medical screening. Remember, all patients, regardless of the method of PT access, need to be screened. Screening process should be continuous and over the course of care, so it's ongoing. And we're looking for both red and yellow flags. When dealing with RI, remember hip bones connected to the knee bone, etc. And then we're also thinking more just structural or biomechanical. We're thinking whole body, visceral, biopsychosocial, etc. In regards to the case study, consider the structures under the area of the symptoms or that refer to that area. How can this play into our hypothesis development? So is it more neuromuscular, more neurological, more visceral, more sinister, etc.? And then what questions do we want to ask to help rule in or rule out our hypothesis? We're trying to just rule our hypothesis either up or down the chain. And then next block, moving on to the hip. There is a video, I believe, that goes along with that. Make sure that you review that. And contact me with any questions. Thanks for hanging in there, guys, with this canvas. It's not the most user-friendly, but we're dealing with what we can. We're also trying to be a little more lenient with some of the stuff initially. We'll probably try and streamline that a little bit more and be a little more strict with everything that we're looking for. But you guys are doing great. Keep it up. Remember also to refer back to what group you are in, and please just answer within that group. So if you're Alpha Bravo Charlie, stay within that group so you're able to kind of get familiar with that group. Those groups will only be the same for this next block, and then in block 3 and 4 we will switch it up. So that is it. If you have any questions, let me know. Otherwise, keep it up. Good job.